Hi, welcome back to Takacs McGinnis Elder Law Hour. I'm Barbara McGinnis, and in today's episode we're talking about veterans benefits, what's available and who qualifies, and where do we turn for help.
Right, and I'm your co-host, Tim Takacs. In this segment, and actually the next two segments, we are speaking with Dr. Stubbs, Marvin Stubbs, and Dr. John Jackson of the Tennessee Valley Healthcare System. Welcome, gentlemen.
Thank you for having us.
So, Dr. Jackson, would you tell us who you are and what you do at the Tennessee Valley Healthcare System?
Well, yes, sir. I'm the Associate Chief of Staff for Mental Health, which means that I'm over the mental health programs at all of the campuses at Tennessee Valley. We have psychiatry, psychology, social work, nursing, all of this under us, covering a wider range of from inpatient, outpatient mental health teams that run our services.
Right, and Dr. Stubbs, tell us what you do at the Tennessee Valley Healthcare System.
Yes, good morning. I'm glad to be back with you again.
Yes, you are. Thank you for being here.
And thanks for inviting us back. I'm Dr. Marvin Stubbs, Chief of Geriatric Extended Care. I have the blessed fortune to be at the VA for 32 years.
Right, in geriatrics is where you are. Great.
Correct.
Okay, so can you tell us a little bit about what the Tennessee Valley Healthcare System is? I imagine a lot of viewers, if you're not a veteran, you really don't know. Or maybe you are a veteran and you're not familiar with it.
Well, I think that is a big problem we have out there is a lot of people don't know what we can offer as a system. So, yeah, Tennessee Valley's it's in the top 5, maybe in the top 3 largest in the country. We're a 1A facility, which means we're tertiary care and we have to be affiliated with the medical school. We're fortunate to have 2 medical schools, Meharry and Vanderbilt, affiliated with us. But we offer a range of services that would any top tertiary hospital would be able to. So we have all of the medical specialties, surgical specialties. We are the referral source for the entire country for solid organ transplant. So VAs around the country send us those veterans for kidney or bone marrow even. So we manage all of that. We are on the VHA side, so your last guest was talking about the 2 sides. We're the hospital side.
Hospital Health Administration side.
Yes, sir. And so part of that, though, also is we cross that barrier a little bit that we have a department called C&P, which actually does the exams for those guys. So they'll call us up and say, we think we have a veteran here that might have a disability. Can you take a look? We send them out to one of our sites called International Plaza, and they'll do an examination, give those results over to VBA, who will rate that veteran. So we do cross lanes a little bit, and we have the 2 main campuses. Nashville has a majority of our specialty services, and then Murfreesboro, Dr. Stubbs and I both have programs down there. I have the inpatient psychiatry. All of our long-term care services are down there. And then we have a number of sites across the country, or across the Middle Tennessee area. Cookeville, McMinnville, Clarksville, and Chattanooga are probably our 2 big sites. But we have care out into the community. If it's something that needs specialized care, then they come into Nashville and we care for folks here.
So you must serve hundreds, thousands of veterans. We served over 103,000 veterans last year, and that's individuals. The clinic appointments was probably well over 1 million.
That's totally incredible. Dr. Stubbs, I guess you'd be the one that could tell us about the community living centers. Is that right?
Yes, that is correct. We have one of the largest community living centers in the country. We have 137 community living centers in the VA system. We provide services for veterans who have comprehensive needs. Our community living centers are divided up such that we provide specialized care for specialized veterans. We serve between 132 to 134 veterans per day and hope to serve approximately 164 to 172 by the end of January.
Now, a community living center, is that what used to be like a long-term care facility?
Yes, it is.
It is a long-term care facility.
Yes,
it's just a name change. I guess it sounds more home-like.
Right, and that's what the gist of the change was. We wanted to go to patient-centered, resident-centered care, whereby the community living center will be known as their home, so the home-like environment. So we changed the name to Community Living Center.
So rather than a nursing home, which is like the traditional nursing home, which I'm assuming that the public probably thinks of it as for old, sick people.
Right.
You're really talking about a home for an individual who has long-term care needs.
Correct, and we wanted to change from the medical model to the home-like environment with plants. We have pet therapies and all the things that the veteran can engage the community in and outside the community.
Right. So if I'm a veteran, how do I know whether a community living center would be right for me?
Well, the first thing is to check your eligibility. All veterans have an eligibility package, which is based upon whether or not they're service connected, whether something happened to them while they were in the service, based upon whether it was wartime, or based upon their income. So the first thing to check out your eligibility package. All veterans are eligible for long-term care services, but based upon what eligibility package.
So would a veteran, say, go to a veteran service officer?
Right,
so that might be a good entry point.
Check the VA internet, and they can get further information, get assigned to a primary care provider, which is also the key.
So a VSO to getting assignment to a primary care provider,
right?
You know, and then the primary care provider helps them determine whether that's a right fit for them.
Right, navigate the system.
And I'd like to point out that we have them right in our lobby. So if you come to the Nashville campus, the DAV is there. We have the VBA representatives. They have offices right in our main lobby.
Okay, and where's that lobby?
Right there behind, by Vanderbilt on, was it 1310 24th Avenue South?
1310 24th Avenue South.
Yeah,
so if you can find Vanderbilt.
Yes, sir, right off of 24th Avenue.
Okay.
It's the building that looks like a ship. It's supposed to look like a naval ship.
Okay.
Okay.
It does.
But that's very convenient for people, for patients and
Yes,
their
ma'am.
families to have those resources right there. Okay, so
And
all
then they
that.
have the settlement community also, the VSO,
Okay.
the community
Okay.
also.
Right.
So it's
So all
plenty of
veterans are
access.
eligible to live there, of course. But the bed ratio to the pool of potential needs, there's bound to be a waiting list.
Well, what we look at is what is the functional level of the veteran? What does he need? So we have specialized unit for specialized veterans. So we have 7 community living centers. One of the community centers offer care for people who require end-of-life care, and those veterans assess that they need to have a provider in-house, a team in-house, which composes a social worker, physical therapist, pharmacy, nurses that are skilled in end-of-life services. Then we have a subacute area for veterans that require IV antibiotics, complex wound care, long-term vet care. And then we also have a community living center for veterans with long-term care needs related to mental illness that require a gated community.
Right.
Then we also have a community living center for veterans that require dementia care, veterans who have progressive loss of memory.
So you run the gamut for community living center.
Right.
Now, what about veterans who maybe do have chronic conditions but don't need that level of care? Like, say, is there a home-based? I think it's the home-based primary care program.
Yes, we have a home-based primary care program, and also we have a program for geriatric patients that need primary care. So we have 2 different programs. The home-based primary care program goes out into the home of the veterans and delivers care just like a primary care team would do.
Right.
It consists of a provider, a social work, physical therapy, and occupational therapists and nutritionists.
Right.
So how's that paid for? Does it cost the veteran?
It's based upon the eligibility program, and it's based upon primary care. If you have a primary care copay, then you have a home-based primary care copay. So you have to check out your benefits package. People who are service-connected usually are exempt from payment.
Okay.
Right. Sounds to me like there's like a priority group or something that you get in, and that's one of those things. That's the next show. We'll have you back on for talk about priority groups. Okay. What about spouses? Are any veterans or spouses of veterans eligible in any of these programs?
Well, what we encourage our spouses to come to all appointments and be involved in the health care of their veterans. We have a family council for our community living center where the spouses come in, make suggestions to us. One of the great things about Tennessee Valley Healthcare, we really are accountable for the needs of our veterans, and we take all types of comments, positive and negative, so we get input from the spouses and the like, and they...
All right, so we've got like 30 seconds here, so we're going to put your quick and that runs fast. So we're going to
Contact information up there.
Oh, great.
All right, so thank you, Dr. Jackson, Dr. Stubbs. I know you're still on the panel, Dr. Stubbs, so if you can hang around here later if we have a question, but I think someone else is coming in.
Thank you so much.
You're welcome.
You
Thank
don't know
you.
how important it is getting this out for us.
Okay, so when we get, come back, we'll be back for more with the Tennessee Valley Healthcare System, so stay with us.
Thanks.